Welcome to Season 5 of Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Joshua Sharfstein, Vice Dean for Public Health Practice and Community Engagement and a former health commissioner here in Baltimore, Maryland. Our goal with this podcast is to bring scientific evidence and experience to shed light on critical health issues. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Today, in honor of Black History Month, we turn to the powerful work of Dr. W.E.B. Du Bois, whose 1899 study of tuberculosis in Philadelphia is a classic. It is also, unfortunately, a classic that is rarely taught. We'll hear from Johns Hopkins sociologist Dr. Alexander White about this seminal work, and then from pediatrician and health equity scholar Dr. Rachel Thornton. She speaks to the valuable and energizing lessons of this history for the medical and public health fields today. Let's listen. Professor White, Dr. Thornton, welcome to Public Health on Call. Thanks for coming to talk to me today during Black History Month about your recent article in the New England Journal of Medicine called Remembering Past Lessons About Structural Racism, Recentering Black Theorists of Health and Society. This is an essay about a part of history that isn't known by many people. And maybe I'll start with you, Professor White. Tell us about it.
Well, firstly, thank you so much for having me. This is a real treat to be here. Yeah, I mean, I think the genesis of this paper that I wrote with Dr. Jeremy Green and Dr. Thornton focuses really on this reckoning that we're seeing at the moment relating to how to effectively understand structural racism as a force for producing health inequities and producing negative health effects at the same time as we're seeing a pandemic occur across the world, an epidemic in the United States that is highlighting the disparities along racial lines in health so very clearly. So we in this paper, what we sought to do was really look at histories of what we might call Black counterpublics to public health, or Black scholars who are writing about health and health inequities throughout history. And we focus in particular in this piece on the work of W.E.B. Du Bois, but not exclusively, in the Philadelphia Negro, and the ways in which fundamentally Du Bois looked at the social forces that were affecting health outcomes for Black populations across Philadelphia.
So today people are looking at the stark inequities, for example, in COVID, deaths and other major health challenges. And for some people, it seems new to them, but it's not that new.
That's exactly right. This work isn't new, and the understandings of it are not new. I think what we're seeing currently is very much a reinvigoration of conversations that have been occurring, especially in the Black community, really for at least over 100 years, as we can trace in the scholarly world.
So W.E.B. Du Bois, tell us about him.
Yeah. So my background is in sociology. And my undergraduate degree was in Black studies. And W.E.B. Du Bois is essentially the first scholar you read, I think, whenever you take an introductory course to Black studies, at least in the United States. And you start off by reading, so often, The Souls of Black Folk. Du Bois was the first Black man to graduate from Harvard University with a PhD. He traveled around the world, and he was a prolific sociologist. He was a novelist. He was a playwright. He produced a variety of magazines and newspapers. He was really this polymathic figure and continued to write and work up until his death in the 1960s. And we must remember that Philadelphia Negro was published in 1899. So he really produced this massive, massive corpus of work. And his contributions to sociology especially are that of a brilliant theorist and brilliant methodologist who brought forward completely new ways of approaching research and new ways of understanding, especially the ways in which racism operates in the world.
At the time, there were prevailing narratives that were very much based on what are now, and really then were discredited theories of genetics related to race. How did he respond to this?
That's right. So the Philadelphia Negro was written and published with support from the University of Pennsylvania at a time when there was a very significant epidemic of tuberculosis occurring across the United States and producing overwhelmingly devastating responses in the Black community and communities, especially Black urban communities. And one of the more popular books at the time relating to this question of illness, health, and disease that focused in particular on health disparities was a work published by Frederick Hoffman, who was an actuary at Prudential Insurance, called Race Traits and Tendencies of the American Negro. And that was published in 1896. And what that piece suggested was that Hoffman had data proving that Black people were not effectively adapted to both freedom after the abolition of slavery, but also doomed to imminent extinction because of fundamental biological differences. And what he did was he looked at case rates and death rates in tuberculosis between white and Black populations and surmised that these disparities alone would tell us that Black people in the United States were kind of doomed to some form of racial extinction. And what Du Bois did in the Philadelphia Negro was fundamentally refute all of these arguments. The methodological advances that Du Bois put forward by doing both historical research, by conducting interviews and surveys, as well as looking at demographic data, provided a much more complex, much more rich picture of the social dynamics of Philadelphia in the last decades of the 19th century that then explained and proved, really at a time when we weren't even thinking about health disparities and social determinants of health, he proved that social forces were fundamental to affecting health outcomes, who lives, who dies, who gets sick, and why.
So it sounds like that W.E.B. Du Bois's argument was a real challenge to the prevailing wisdom. How was it received?
Well, I mean, I think we have to start with just understanding the massive methodological transformation that the Philadelphia Negro was. This was a study funded by the University of Pennsylvania, but it included qualitative interviews with all families in the 7th Ward of Philadelphia, which is where the research was set, combined with surveys, archival materials that looked at the role of slavery, the slave trade, as well as the Civil War in leading this particular group of people to be living and finding themselves in Philadelphia at the time, ethnographic participant observation, and then cross-checking all qualitative and quantitative data to ensure accuracy. And this was a massive departure from what Du Bois actually himself called car window sociology, which was kind of the idea that you could derive everything you needed to know about the social conditions of a place from essentially snapshots that you could take from a moving car. And this was really the way it was seen before. And what Du Bois's contribution was in this study was also to recognize critically an approach to studying Black people and Black folks in America, not as a problem of sudden urbanization stemming from the Great Migration, as a problem to be solved, as people either to be assimilated into a white urban way of life or to be discarded or controlled in a variety of different ways, but to recognize fundamentally why the conditions, the disparities, the situations, and I mean by disparities, I mean both health and socioeconomic disparities existed in the way that they did in these neighborhoods. So I think the contribution is obviously massive, but unfortunately, especially because of what Alden Morris has called, he calls Du Bois a scholar denied, right? And there's this sort of epistemic apartheid, especially in sociology, that occurs where Du Bois's work is elided so much and under-recognized in the field of sociology, and especially American sociology, really until the 21st century. We see all this work become formative for the production of fields like Black studies and Africana studies, but in sociology, in public health, in medicine, all of these spaces where he made very real contributions, immediate, urgent contributions in the late 19th century, his voice falls away as a result of both the racism he faced, but also the ways in which our institutions and structures are organized and have been organized to ignore work of this kind. So the Philadelphia Negro, not just looking at health inequalities, but looking at a variety of labor, social, political conditions, paved the way for modern social scientific research. But so much of it has had to be relearned, learned differently, or just fundamentally, forgotten since then.
So, Dr. Thornton, I want to turn to you. You have done a tremendous amount of work on the social contributors to disease in your career. When did you first learn about W.E.B. Du Bois?
Thanks so much, Josh, for having me, and Professor White for always offering me additional education on the topics at hand every time we talk. I'm so inspired, and I'm smarter every time. So, Josh, actually, it is so wonderful that we're doing this during Black History Month, because I will tell you, the first exposure and introduction I had to W.E.B. Du Bois occurred when I was in 5th grade. And I was instructed to write a report on a notable member of the African American community and their contributions. And, we were oftentimes directed towards figures that I know are frequently recognized and should be, Reverend Dr. Martin Luther King, George Washington Carver. And my mother said to me, "Why don't you pick someone different? Why don't you learn about W.E.B. Du Bois?" I said, "Well, who's that?" And she said, "Well, go look him up. He was the first Black man to graduate with a PhD from Harvard University." And I just started looking into who he was, his scholarly work and travels to Germany, his participation in the Niagara movement and subsequently the NAACP. And I was blown away. And he became a childhood hero. This is from, remember, the perspective of a 10-year-old girl who was kind of nerdy and being told from an early age she was going to go into science. And in my high school years, I remember reading his essays, particularly Souls of Black Folks. He inspired me to learn more about the Harlem Renaissance, as a predecessor to building Black intelligentsia. And I just really became obsessed with him and his contributions, not having any knowledge of the connection of his work to medical sociology and to my future career as a health disparities researcher. So that was my initial exposure. I was just really captivated by his ability to articulate the complexities of the Black experience in America. We quote it in our piece, "How does it feel to be a problem?" This notion of, inherently being the source of your own disadvantage and suffering. And it just spoke to me as something intellectually that inspired me to think differently, think critically about the prevailing narratives.
So from 5th grade and your first exposure to W.E.B. Du Bois, you went through your secondary school to college, medical school, public health school, your training in pediatrics. Did the education system do this important work justice along the way? You had obviously a unique vantage point coming in with a good knowledge.
I mean, Josh, the short answer to that, if we're talking about the formal education that I received, particularly in medical school and graduate school in health policy and management, the short answer would be no, with the notable exception perhaps of 1 or 2 courses in graduate school. But what I would say is my education, and I think every child and young person's education, is a accumulation of what they're learning in the formal educational system and the other things that they're exposed to and have the opportunities to apply their own curiosity to. And I had the tremendous benefit of an uncle who was a scholar in African American and African diaspora studies and a mother who was an educator. So at every point aligned with my interests at the time, they would bring Black scholars to me. They would bring relevant scholarship to health disparities to me. But when I asked in history of medicine, as we were learning about the Flexner report and about the amazing contributions, of the institution where I trained to modern medical science, whether or not we were going to discuss the point at which Blacks were admitted to medical school, given the amount of pride that the institution had about the admission of women, the question was never really addressed. And I don't ever recall demonstrably learning that information as a significant aspect of the field and the institution's contributions. When I asked in graduate school, in addition to scholars like Durkheim, were we going to study the Philadelphia Negro, I was basically told it wasn't as significant. And so I think the thing that really highlights this for me as something that many of my colleagues have also faced is the number of people who reached out to me after this article saying, I actually care about health disparities. And I had no idea in all my medical training of this body of scholarship. Thank you guys so much for unearthing it for us. So that speaks to me to say, this is not just about my particular experience, but that I think there is an opportunity here to fill in the nature of medical education with a more intentional treatment of scholarship such as this that gives us a different understanding, a different framing for disparities that are driven by social forces, be that racism or other intersecting social forces. I hope that answers your question.
Absolutely. Back to you, Professor White. What's lost when concepts are sort of reintroduced, but without their historical context, when people are learning, say, about health equity, but not learning about the Philadelphia Negro and some of the original debates that were happening, and particularly the voices of Black scholars like W.E.B. Du Bois?
That's a wonderful question. And it's something that I think Dr. Thornton, Dr. Jeremy Green, and I have been thinking about for a while. And I think are still thinking about significantly. This paper in so many ways came out of an opportunity that Dr. Thornton gave Dr. Green and I to present to all the first-year medical students at Johns Hopkins University about understanding concepts of racial difference and disparity. And we all felt that so often, especially from a medical school standpoint, students get this kind of early inoculation in how to think about racism, and how to think about race and racism, health and health disparities, that is meant to kind of guide or provide, just basically a patch to understand that racism is a force that affects health, but it's up to you to figure it out along the way. And I think that this, to our thoughts, is somewhat insufficient, because racism is not just about whether or not you have certain biases and predispositions towards certain groups and certain negative feelings about others. It's actually about fundamentally understanding and recognizing, or at least the process of anti-racist work is about recognizing the structural forces that operate on people who are minoritized and racialized, and how that plays out in day-to-day life. And I think what Du Bois does so richly, and I think in positing this question, how does it feel to be a problem, as a fundamental question of sociological inquiry, what he does is shift our orientation away from looking at health disparities as problems to be solved, but rather looking at people, all people, but especially Black people and African Americans, as communities to be understood, included, empathized with, as equally human, such that we can resolve these health disparities in the long term and resolve a host of other issues. So I think that, what Du Bois provides us is more than just an understanding of disparities and a kind of a methodological look at how particular social forces produce certain health outcomes. He provides us with an orientation. I think it's a lifelong intellectual orientation to consider all of these dynamics at all times, in whether it's public health practice, whether it's medical practice, whether it's sociological practice, considering humans and humanness in a particular way that recognizes Black humanity, Black agency, and the forces that operate through racism to affect all manner of outcomes.
How does studying the history we've been talking about, the Philadelphia Negro, the work of W.E.B. Du Bois, help with that shift?
I think that's a really important question, Josh. And I first of all, I think that understanding historical origins for social phenomena that recur or patterns that consistently exist in our field is empowering. It empowers us not to think about each disparity as living in a vacuum, separate from a set of social and historical forces that shape all of them. And, I think it is always difficult for those of us with a heart for service in a profession where we believe we have come to do good, to look historically at the times where we may have done less than good with the information we had at hand. And yet, if we don't take that critical lens, if we don't learn from the body of research and evidence and experience that comes before, I don't think we're optimally able to make the next step. So what I think we talk about in this piece is the fact that there's been so much rediscovery of phenomena that if we had embraced them in 1899, think what we could have done to develop a set of interventions and approaches to ameliorate and minimize those differences and those inequities. We have not done that. We've continued along a line of refuting a set of patterns that consistently reappear. And I think we're at a point where we have to look at that historical consistency of observing the patterns and of observing the structures and phenomena that reproduce those patterns, and now move into a phase of taking all of that knowledge, not refuting or rediscovering it, but using it to develop a set of tools that will allow us to do something different and to produce a different set of outcomes than the outcomes that we have continued to produce over centuries.
In a way, studying history not only gives us knowledge, but it gives us perspective, and as you're just talking, it gives us urgency.
Absolutely. And it empowers us to move beyond what we have already established, right? And it empowers us to, in this case, embrace racism as a structural phenomena that produces and contributes to inequities in health. Not as the only structural phenomena, but as a critically important one that we can't ignore.
Dr. Thornton, Professor White, thank you so much for joining me today to talk about this really interesting and important topic.
Thank you so much, Josh. Absolute pleasure.
Thank you.
Public Health On Call is produced by Joshua Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmond. Audio production by Niall Owen McCusker, Matthew Martin, Spencer Greer, and Holly Cardinale, with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo. Social media support from Grace Holz Fernandez. Thank you for listening.